As my advocate throughout the whole of the case, which eventually lasted a matter of a couple of years, and only just recently, in the past week actually, I've withdrawn any further action in it. My wife was so into dementia at that time that she herself, she wanted me to handle everything.
Advocacy is important for older people because older people need to learn to advocate for themselves and in conjunction with groups or organizations like Vopa to support them.
It's about older people recognising there is the need for the expertise and the importance of advocacy for them and being able to grasp the nettle in some ways and grasp what's available and go down that road into implementing their own form. You want to feel like you're still contributing, that you're making a difference to yourself and others, and that the best method of doing this could be advocacy.
Constantly trying to bang on the door to say you must participate in whatever is happening. When the seminar conferences or whatever is going on, we must participate in that and look at what is happening all around you and take some pride in what is happening.
I feel like advocacy is very much under-resourced service, and there's always, at the end of the day, given the image that it's an add-on, but it isn't. It's an integral part of life, and we need to be upgrading that. The way things are done at present does not allow for the fact that planning for older people's lives has reached a state of chaos and crisis, and does not allow older people's expertise and skills in the process to be used. 50 plus is now considered older people. So why should they feel like they're being, I don't know what the word is, demoralised or whatever, demoted, when it's not the case? They should be glad that they're joining us, and that we've got to encourage them, take up the mantle, and get more services and understanding of what it's like to be an older person and what you want for the rest of your life. I mean, we're talking about 50 years of our lives, for goodness sake. We don't want to be feeling like we've passed the mantle on to these people, my daughter and son's generation, that they're going to be feeling, oh, well, it's not worth having.
Yes. And I would like to say that I'd like to see Vopa lead the way in education for older people. Lifelong learning is something. Although the organization is there to speak for you, we need to, and Vopa need to educate people to speak for themselves as well. Because people are not with you 24 hours a day. You are with you and with me 24 hours a day. Therefore, the advocacy element needs to start with me and move up the ladder to whatever government is saying. Vopa is speaking to government and government ministers, and I'm speaking with Vopa. This is the clear link of communications from the bottom to the top in central government. Vopa have its website, Vopa have a good membership, and they have a newsletter, and it have its own worker. We have a good network of the 9 regions up and down the country, yes? So it kind of branch out in different areas, and in every borough too, there's local advocacy agent where Vopa is introducing itself to local people.
We've had enough of rationing. We've had it most of our lives, and then when we reach a certain age, we're being told we can't have healthcare, we can't have services that we need, we can't do what we want to do if we want to do education later in life, or whatever. I think that's really degrading.
Well, having experienced advocacy myself, I would highly recommend it to any older person, especially if you find it difficult to speak for yourself and have difficulty in expressing your views, which sometimes somebody else can do for you in a more perhaps professional manner than you are capable of doing it yourself. In my case, when I was dealing with consultants and doctors, and I perhaps was not coming out with the right words, and if medical people are speaking to you in medical terms and you don't understand them, it is very beneficial to have somebody there to take the notes down that you can't actually take in yourself. And then you can go back on it at a later date and say, well, this was said and whatever.
Would you ever think that you could provide some advocacy to somebody? Maybe someone in your situation now that you've been through it?
Well, I would be quite good at speaking and helping people in that respect, but unfortunately I'm no good at writing. But certainly in regards to standing up or going along with somebody to an appointment, various things like that, yes, I would. I think having been through it, I would now know the questions to ask, which I didn't before.
Visually handicapped people, often suffering from macular degeneration, will need long-term help, because if they've always dealt with their own affairs quite competently, it's shattering not to be able to read and do it yourself. If you've got a kind friend or relative who can come and help, well, that would be all right. But if many people, older people, have no one to help them, and so an advocate not in the case of somebody with macular degeneration, wouldn't just read, but also would help them with other things. And mostly it helps being able to have access to things that you couldn't do on your own. You may not be excited about filling in an income tax form, but if you are sent one and aren't able to do it, then you obviously feel, well, quite at a loss. Without advocacy to help, I put in a claim for an attendance allowance for this gentleman, and we were able to get that, which he took with him to help pay for his fee when he moved into a residential home. On another occasion, somebody in a residential home was should have been partly funded by payment from her pension. She had been a public health worker, so that pension money was having to be used to fund her, and she was very depressed and had never looked at her account and asked me to look at it one day, and I found that she was nearly £1,000 in the red. And what had happened, when the social worker who arranged for her to be admitted into the home, what he had not done was to check that the money from this pension, which was supposed to be used to pay for her care in the home, partly to pay for it, just hadn't been organised. And as a result of that, Age Concern in Camden made sure that every social worker was told that part of the job when arranging for somebody to go into a residential home would be to make sure that all the funding that was supposed to pay for it was in place.
I work for an advocacy organisation, and the feedback that we've always got in all the work we've done from older people themselves is that the advocacy service that they've received is unlike any other service they've ever received from anywhere else. And that's usually down to the fact that advocates will go to them, advocates will spend time with them, and advocates will build a relationship with the older person so that the advocacy they give to them is as individual as the person themselves. So it's not kind of like a tick box situation. It's not a one-stop shop where we can only go and do one thing for them. Because an advocate can give the kind of the quality of time, it means that they can give a kind of quality of service that they just can't get anywhere else. It is making sure that they are heard, that their dignity is upheld, that those important quality of life issues, everybody wants to feel like a human being and to be treated in a certain way, and they're upholding those things for people. It's as individual as the people are individual. So if I was an advocate for one person, I might be making phone calls, writing letters. If I was an advocate for someone else, I might be dealing with an abuse issue. If I was an advocate for someone else, I might be helping someone reunite with a family that they haven't seen in 50 years. Sometimes people phone us and say, I need help filling in a form. And then we'll turn up at their house and we'll spend an hour with them. And they'll say, and in the course of that hour, we'll find out that they need so much more. It's not just about filling out the form, it's about they find it difficult to make phone calls, and their money has been stolen, and there's a whole abuse kind of angle to it too. So what we then will spend time doing is matching the correct advocate with the older person. So it could be that somebody who's just in a crisis situation, I need someone to come in and make just a few phone calls, someone who's really good at writing letters and talking to professionals, and that's the experience we need. Or it could be that somebody needs someone who can make a long-term commitment to working with them and will sit and just listen to them and kind of almost provide a counselling ear. So I think it is right, it's very much based on what the older person needs. I think there's definitely a difficulty in people understanding what advocacy is. And in fact, there's a difficulty in kind of explaining to people what advocacy is. I ran a project for about 5 years in a local care home. There were 5 local care homes that were closing, and going in, kind of turning up at people's homes and kind of going into their lounge and saying, hi, I'm Sam, I'm an advocate. And people would be like, avocado? What are you talking about? What does that mean to me? When we train, when we recruit advocates, what we are looking for are attributes. We're not looking for people who are experts, who are, highly trained or even have a huge amount of experience. We're looking for the kind of attributes in a person, like they are compassionate, they listen, they really care, they want to help, and they are willing to build a human relationship with another person. The way that we try to do it, we try to be creative in terms of finding local people who want to help, training them. We're always looking at ways that we can make our training more effective, how we can make what we do kind of more effective. And I think that one of the things that we try to do is we are led by the older people in the borough. So it's not about us kind of creating a service that we think is good. It's about the older people in the borough come to us, and by telling us their needs, and they're the ones who tell us, look, this is the gap in the service. On the one hand, as an organisation, we have older people saying to us all the time, why didn't I know about this? How did I not know that this existed? How did I not know that people could help me in this way? Why don't you do more publicity? Why don't you kind of tell more people about yourselves? And where we would love to do that, and need to do that on some level, we have to be really careful, because every time we've done any kind of publicity drive like that, we've ended up with so many people calling us, and our resources are so limited, and we're such a small organisation that we end up with a massive waiting list. So these people kind of coming to us thinking, brilliant, an advocate can help me and stand up for me and help me with this kind of crisis situation I'm in. And in fact, unfortunately, we can't. We can't do it as quickly as possible as we'd like to. Do you want to kind of think about, are we increasing the numbers of people we see, or do you want to look at the quality of the service? If you're talking about, if I have a volunteer, I could, if I limited them to 1 year spent with an older person, then they could see 10 people over those years. But if I believe that the importance is in the relationship and providing that kind of quality of service for someone, they might only be able to see one person for 10 years because that person needs them for those 10 years. We've tried to be creative. We've done things like focus groups. We've done groups in homes. We've kind of we have looked at ways to get the older people we work with more involved to become advocates themselves. But a lot of the older people we're working with are right at the end of their life. They're 85, 90 plus. And the issues that have made them had to come to us in the first place aren't going to get better. I mean, extra funding for extra staff, if it was a duty for the local authority that they had to provide an advocate in certain situations for older people, that would definitely help us, because it would mean other funders would open up funding lines that we could go for. Advocacy is the first thing to go, because it's not seen as absolutely crucial to an older person's life. The commissioners have said to us, well, do you want me to pay for someone to have Meals on Wheels and food, and someone who can go and help, dress them and clean them, or do you want us to pay for an advocate? And it's a very difficult argument. Of course, I don't want food and care taken away from somebody, but to me it means they've not understood the quality and the importance of what an advocate can do and what an advocacy service can do. Maybe I'm biased, but the older people I've worked with say to us, I would have died. I would have gone under. I would no longer be living in my home. I would no longer be part of my community. I would no longer have the dignity of being able to make a choice for myself. And that absolutely, at the end of the day, is crucial to them.